our citizens for doing the right thing. We know the results are positive, they're all heading in the right direction, and we want them to stay this way. So I want to thank everybody for the way that we're managing this. Although it's been very difficult for many of us, everybody has really stepped up, and I want to express my deepest gratitude. And as Dr. Chant has also said, we are looking to expand the testing regime. We already have, on average, on a good day, between 4,000 and 4,500, even 5,000 people getting tested. We've nominated the hotspots where that testing should occur in a more proactive way. We're asking everybody in those hotspots to come forward. We're also asking people who work with vulnerable communities or work in jobs where they're in contact with a lot of people, even through social distancing, to come forward and get tested as well. And in the future, of course, we will see that relaxed even further to the extent where others will be asked to come and get proactively tested. We have one of the highest testing rates in the world, and that's one of the reasons I believe New South Wales is in the position we are when it comes to fighting the COVID virus. This year in particular, we've had to do many things differently that we would otherwise do, whether it's Easter and now, obviously, with Anzac Day just a few days away. We know this will be a very different Anzac Day, but I think more than ever, all of us will come to contemplate and appreciate what our Anzacs did in 1915 and what Anzac Day represents, and what our defence communities, what our defence personnel, ex-servicemen and women, currently serving men and women, what they've done for our state and our nation is outstanding, and the sacrifices that generations have made before us come into greater significance given what all of us are going through this year. And I want to thank Minister Lee and also Mr. Ray James from the RSL, who joins us here this morning, for putting in place alternative measures for New South Wales. As many of you know, the dawn service from Canberra, which the Prime Minister is leading, will occur and will be televised. New South Wales will also have our own service at 10 a.m, and we do encourage families to participate together, to use that time to watch the live stream service, but also to take the opportunity to reflect, to contemplate, to thank, and more than ever, to put ourselves in the situation of those who've sacrificed for the freedom and liberty of all of us. And I think this Anzac Day, more than others, will be able to really soak the significance of this momentous day. And I want to thank the RSL community, especially those communities in rural and regional areas who are used to going to their local memorial park or the memorial place of respect and worship. But unfortunately this year, all of us have to do things differently. We can't turn up to the dawn service, we can't turn up to marches, we can't turn up to those regular things we do, but what we can do is still honour our servicemen and women, past and present. We can still acknowledge those in our family who've served, and of course support the RSL in their efforts in making sure everybody appreciates the significance of Anzac Day this year, although it will be done in different circumstances. I'll ask Dr. Chant to give us her daily medical update. The Commissioner will provide us with his update, and then Dr. Lee and Mr. James from the RSL will give us more details on the specific things New South Wales will be doing to commemorate Anzac Day, something we hope all of our citizens will participate in to really appreciate and thank the men and women who fought for our freedoms. Thank you.
As the Premier's indicated, we've had 5 new cases. Tests are reported in the 24 hours to 8 p.m. on the 21st of April. There have been 33 deaths in New South Wales up until 8 p.m. on the 21st, with 3 deaths in that 24-hour reporting period. There are currently 231 COVID cases being treated by New South Wales Health, and this includes 20 people being treated in intensive care units, with 16 of those requiring ventilators. The 3 further deaths relate to a 75-year-old gentleman who passed away in St George Hospital and was a household contact of a known case, an 80-year-old woman who passed away in Gosford Hospital with pre-existing medical conditions who was part of a Gosford Hospital cluster, and a 92-year-old woman who was a resident of the Anglicare Newmarch House at Caddens and who is the 3rd death in that facility. There have been no new cases at that aged care facility in Caddens, and there remains a total of 42 cases, 14 staff and 28 residents.
Thanks. Good morning. As you are, the Ruby Princess is docked off at Port Kembla. Yesterday, 57 crew members were escorted off the ship and a number have already flown home. Over the next 3 days, the balance of that 57 will be repatriated back to their home countries. The Commissioner of Border Force has written to Carnival and directed that the Ruby Princess leaves Australian waters from this Thursday. So from New South Wales Police perspective, we are still working to that date. There are a number of other potential crew members who may be repatriated. We are waiting for information from either Carnival or other consulates in terms of absolutely fixed travel arrangements for those individuals. There's around 40 crew members who are corona positive that Health are monitoring closely, and will continue to work with Health between now and Thursday to bring any crew members off the ship who require urgent medical treatment. Thank you.
It's Mick Fuller there. We'll keep an eye across that press conference, and if there